The information discussed in this episode is general in nature and it is not intended as personalised medical advice. Individual assessment and consultation with a doctor are essential before considering any treatment. So welcome to Aesthetics Unfiltered, honest conversations about doctor-led regenerative aesthetics.
And this session is going to be on Ultherapy.
Ultherapy Prime.
Exactly.
Yeah.
So
got a few different names. We'll probably use them interchangeably. Ultherapy is a fantastic foundation treatment. It's an ultrasound-based skin tightening device, and I think we were the first to have.
So I think Neve and I received the first machine about 8 years ago.
Okay.
In clinic when we were in Jerringham Street, around the corner from St John of God, and that machine was one of the most used devices. And now we have the new and improved Ultherapy Prime, which is a much quicker machine.
Yep.
But it is amazing. So we have had that machine and then the advanced thing for about 8 years.
Yep. Do you think it's increased in popularity, or do you think that it's been a foundation treatment you've used pretty much from the get-go?
We used it a lot at the start, but I don't think we honestly realised how foundational and how important it was in that the whole treatment planning until we started doing studies.
Yeah.
So Neve did some studies and has published on it.
Yeah.
And it was from there when we actually did the photos with the Visia, the medical, they measured everything. I think it was then when we actually saw it, we thought, you know what?
Yeah, the results speak for themselves.
Speaks for itself, and patients could see it.
Yeah, that's really important.
And the good thing is there's no real downtime.
Yeah.
So everybody loves it. And it is probably our most used device in the clinic, really.
Yeah, it certainly is. We're very lucky to have upgraded to the Ultherapy Prime platform recently. Not recently, probably 12 months ago, 18 months ago
12,
now.
18 months ago. And I think the thing with the Ulthera or Ultherapy Prime, all of the above, sometimes it's confused with HIFU. So you might want to explain why it is so much safer than HIFU.
So Ulthera is essentially, it's an ultrasound-based tissue tightening device. So it sends two ultrasound sound waves down into a single point underneath the tissues, underneath your skin in the fatty layer. And when those little sound waves collide, they create friction and heat. So essentially you're creating tiny little micro burns or micro wounds underneath the skin. And that heat, by creating a wound, we have to get our wound healing processes in. So our immune system is activated and we lay down new collagen. So this tightens up the skin overlying the muscles. HIFU is a bit different. So HIFU is high intensity focused ultrasound. Ultherapy is micro focused ultrasound with visualization. So there's two differences there. HIFU is not as micro focused. So it's like dropping a bomb of heat on a whole area rather than micro focusing the heat into a little specific area. And Ultherapy has visualization. So with HIFU, you can't see on the ultrasound screen where you're going. There is no ultrasound screen. So it's like me closing my eyes and treating you blind. When I can see with the visualization with Ultherapy, I know that I am delivering the heat into the exact layer that I want to create new collagen in that area. And it also tightens up the existing collagen fibers that are already there between our muscle layer and our skin layer. So there's some pretty big differences there. In our clinic, we don't just treat one small area. Sometimes we do, if we think that Ulthera is going to benefit our patient in just a tiny little area. So sometimes we can just use it for a little brow lift, noting that results do take time and it's a regenerative treatment. And
they do vary, results vary.
Yeah, exactly. So after your medical consultation, once we've realised or worked out that it is a good treatment option for that patient, we actually tend to treat the whole face and the upper neck. So we follow the high five protocol, and this was a protocol written by our wonderful Dr. Neve Corder, plastic surgeon, and a fantastic cosmetic physician in Sydney named Dr. Stephen Lowe. They worked together to publish some research on treating the whole face and neck, because traditionally with Ultherapy treatment protocols, we were treating the whole face and neck all at once, so in one long treatment session.
Yes, I remember those days when we first tried the machine. I was like, holy heck.
It's a long
But it worked.
time. Yeah. It takes a couple of hours, a standard treatment protocol. And Ultherapy can be quite uncomfortable, quite painful. So a standard treatment protocol was a lot for a patient to undertake. It took time, it was painful, and it was quite an expensive outlay, or a financial outlay at the beginning.
When you started doing then, like with the Ultherapy Prime, that then changed even the amount of time that you would do. So you kept doing the high five protocol.
Yes.
And then you've sort of worked out now through lots of experience, and I mean you've done hundreds of faces now.
I have now.
Hundreds.
Yeah.
That it does work very well, but you have to be medically suitable.
Yeah.
So take us through some of the patients that might not be suitable.
It's a good question. So because we're putting heat underneath the tissues and we're creating a little micro wound, we need to make sure that the patient's immune system is good, so that they're going to be able to heal those little micro wounds and lay down collagen and elastin. So we don't want to be treating anyone who's a heavy smoker or a smoker at all, because they don't have the same wound healing pathways, and they're just not going to get a very good result.
They don't. And anybody that's involved with medical knows that, even if they're a smoker and you're doing surgery, they're not going to heal properly.
No.
So it's the same sort of principle, because it's very important to screen them.
There's also, if you've got poorly controlled diabetes or any other immune disorder, an autoimmune disorder that's not being managed, things like that.
So if you've got psoriasis, for instance, or
any
rheumatoid arthritis, those sort of drugs can make it. Yeah, it's just
they lower your immune system, and you're probably unlikely to get as good a result from Ultherapy as you would if you had well-controlled disease.
I know I see a big difference in the patients now returning. So once upon a time they would love the result, but it would be like, oh my goodness, I've got to just really get myself geared up. And I know I have to admit I was the same. It was like, oh God, I love that treatment, but gee, it's so painful. And I have a very high pain threshold, as you know. But now we have worked out, there's different ways that we can do it and manage the pain. And these patients are now coming back, booking in and booking. Now I'll book 6 months ahead. So what are we doing different in the pain management side of things?
It's a lot more tolerable now. So I should explain the high five protocol. So that's breaking up the standard treatment protocol that involved 800 to 1,200 treatment lines. We call them treatment lines. The high five protocol breaks this into more manageable sessions. So a session takes about 30 minutes. It's somewhere between 270 to 320 lines across the whole face and upper neck. And that varies according to a few different patient factors, which we can get into later. So a treatment is only 30 minutes. You don't get that wind-up pain. Secondly, for pain management, using numbing cream now we've found is really helpful. So if you apply that for a couple of hours beforehand with strict medical instructions.
Exactly, because there is a very big worry about people sourcing the numbing cream online. We don't know what's in it. You can have serious cardiac issues
you can.
if you are not aware so what you're putting on your face.
Making sure you've had that medical consultation first, and making sure that numbing cream is safe for you, and we can advise on, or your doctor should advise on the maximum dose that you should be using and the areas that you should be applying it to. But we have found that numbing cream is very, very helpful.
It's absolutely
to manage the pain with Ultherapy. And thirdly, the Ultherapy Prime platform. So upgrading our platform to the latest technology. There's actually no lag time with the ultrasound anymore, which means that treatment is a lot faster. So I'm not having to move the machine or the handpiece and then wait for the screen to catch up. So I can move through a treatment session a lot more quickly for patients, and that's really helping.
I think that's the big thing I found too was you'd have to set aside a whole hour with the older machine, and it was just like, oh my goodness, the patient was over it, you're over clicking the thing. And I think that's the thing that people need to realise is that we can tailor it to their specific needs.
Yeah.
And you work it in. And once again, it's individualised.
Yeah.
So when people ring and want to know the price, this is what makes it really hard for anybody that's on the other end of the phone trying to answer their questions, is that we're not trying to get them in and sucker them in for a consultation. It's, we need to check your medical history.
Yeah.
We don't want to take your money.
No, because it's not going to work.
There would
for
be
you.
a lot of people having different types of pie food without medical knowledge, because in actual fact, to have an Ultherapy machine, you have to have a medical clinic. They are not sold to anybody that hasn't got a medical clinic.
Yep. And certainly with using a machine that has ultrasound visualization, the practitioner needs to know what they're looking at on the screen. So you have to have a sound idea of anatomy, and you have to be going to conferences and upskilling and constantly revisiting your anatomy and your clinical skills, so that you're able to deliver the treatment into the exact area that's going to be of benefit to the patient. You mentioned before it's difficult to advise over the phone, definitely. A consultation does have to be quite personalised, individualised to the patient. And I think it's important that we remind patients that Ultherapy, yes, it's a great foundation treatment and it tightens the skin and deeper tissues, but it doesn't mean that that replaces other treatments. Often we need to be performing a few different non-surgical treatments all together to get the best result for the patient. So some people might call up and ask, well, if I have my Ultherapy, does that mean I still need to use vitamin A? The answer is probably yes, and we can run people through that at consultations, and they should be I think
told. That's the big thing is, I think even when they're not having the Ultherapy and they're having other things, they could be having dermal laser, for pigment or vascular sort of problem.
Treatment with schedule for medicines that we can't really give advice about at all. Yeah.
You've still got to use good skincare because you've got to nourish and feed the forest.
Yeah, you do.
What's all this forest
fertilise
and ecosystem underneath that we're trying to get, keep it really healthy and well. You've got to feed it as well.
Yeah. And Ultherapy, as we were saying before, it's not for everyone. There are people with certain medical conditions who shouldn't be having it. And certainly if someone is looking for surgical results or they have really significant skin laxity that's just not going to respond in the way that they want to Ultherapy, then their clinician should be referring them to a plastic surgeon for a consultation about surgery. And people need to make sure that they're seeing or seeking advice from someone who's going to tell them the truth and be honest about it.
And I think that goes for all of these devices in the industry. The claim that they are tightening, lifting, all of these wonderful things that marketing talks about that we all know normally are, we have reps that come in and try to sell us stuff, and unless you are on the ball and you understand the clinical papers that they're giving you, because quite often you get the clinical papers and the results actually aren't even on that machine.
They've used
or the product that they're trying to give to you. So it is really something very important to know your stuff in this aesthetic field. Whether it is a laser, because we can talk about devices, but whether they're sort of talking about that or the other things that they're talking about, it just the evidence just sometimes is not there. You need to be very aware of that.
Yeah, so we need to be making sure that we're going to see a clinician who understands the scientific research and knows that whatever device they're using, Ultherapy included, is based on science. It's based on a body of evidence and some research that's specific to that treatment or machine, and that they're not we're not using results or research from a different machine or a different treatment to back up the treatment that we're trying to educate our patients on. Does that make sense?
Well, it does to me.
Yeah.
We're in the industry, but hopefully to the others it will.
Yeah.
You know, and it's same as, you know, people market themselves as experts and that sort of thing, but you really need to be careful on where you're going.
Yeah.
You know, when you walk into a clinic, they should not look weird. If they look weird, turn around and do not go there, because, you know, it's one of the biggest things that you see in the industry.
Yeah.
There's a lot of great operators out there in the medical field, and I don't mean operators as in surgeons, I mean as in delivering treatments, all from skincare, peels, lasers, all of these types of things. But if they all have morphed and looked alike, and you don't like that look, then chances are, if you're not careful, that's where their eye is. And I think you do have to have a good aesthetic eye.
Yeah. I think definitely a huge topic and something we can talk about in a different episode, I reckon.
Yes, that's a whole episode.
Episode, absolutely.
So with the, probably get back to the Ultherapy prime. How long does it take to see results? Probably.
That's a really good question. So as a tissue tightening device, it's not instant. So we put the heat energy underneath the skin in the fatty layer, and then we wait. So some people actually get a tiny bit of swelling in the treatment area. So certainly for me, after I've had a treatment, I'm finding that my brows have lifted a little bit, and I'm not getting mascara on my upper eyelid for a couple of days. Yeah. And I'm going,
and then it does go down a little bit.
It does.
And then it starts to pick up.
Exactly. So most people will find no difference immediately. About 3 months after their last high five treatment session. So the high five protocol breaks up the standard treatment protocol into 3 to 5 treatment sessions, and that's a conversation that we have with patients when we're first booking them in, how many treatment sessions they're going to have. So the result starts to kick in about 3 months after their last session, and it just improves from there. So at the 6 to 9 month mark, we're seeing skin is tightened, lifted. We certainly see a little bit of a brow lift when we've treated across the forehead. It sort of works to reposition those mid-face fat pads and kind of gives you an overall sort of gently shrink-wrapped look. So it's not paralysing muscles and it's not plumping up volume. You still look natural and normal. It's just that you're looking, your skin and deeper tissues are looking a little tighter. So you're looking healthier and you're looking well. And people find at about the 6 to 9 month mark, they might get comments from friends or family going, gee, you look well. What are you doing differently?
And I think the thing is, the beauty of it is, a lot come and have it done in their lunch break. They'll be working from home or they'll come after work. They'll have it done. They're read for about 20 minutes or so. There can be some slight welting.
You can develop little welts in the treatment areas, which can last a couple of days. I have seen welts last longer than this, but it's very unusual. And they do go away eventually. But most people, if they're going to have a welt, it will last 1 or 2 days and then it's gone. And certainly the redness goes out of it.
It goes very quickly.
Yeah, you're just sort of left with a little line.
I think that's what people like, is that they can come and have it done. And yes, nobody's any the wiser, and you can go about your business, and then you just start to have everything happening underneath.
Underneath the skin. It's a foundation treatment.
But once again, everybody's results will be very different.
And certainly you see the results not start to drop off at 12 months, but people are finding at about that 12-month mark, they're coming in and going, I'm starting to feel I'm feeling a bit flat again. I'm feeling like I'm noticing my jowls or my my eyelids are drooping again. What should we do? We know what's next in my treatment plan. I just want to freshen up.
Yes.
And we go, oh, how long has it been since your Ulthera? Oh, wow, there you go. It was 12 months.
Yeah.
And so we just do one treatment session, somewhere between 270 to 320 lines. Again, we could do more, we could do less. And that just seems to pick people's tissues up again.
I think it's the collagen and elastin is amazing, and I think that is quite well proven on.
It is, there's good evidence for it.
On a lot of medical papers.
Yeah, it works in most patients, in the right patients who have had that consultation to make sure that it's right for them.
So with anything that you hear, it burns out fat.
Oh, yeah, that's a common misconception.
Yes.
I think apart from is it HIFU, to which the answer is no, I think does it melt fat is the second biggest question. The answer is no. And there's been a recent study on this where they've treated someone over and over and over again with hundreds, I think maybe even thousands of treatment lines, and they took biopsies, and no, it does not melt fat. Having said that, Ultherapy is perhaps not best for someone who doesn't have much fat. There are probably better or different treatment options for people who are really, really slim. But it's pretty rare that we come across a patient who's not.
I think the thing is that when we talk about tailoring it, as we know, when you're looking at the face, even if they're very fine, there's a difference with the depth of
That's
heads.
right. Yeah.
So you can actually just apply more pressure with the superficial to actually get down.
Yeah, because the Ultherapy has
and visualization.
Exactly, it's got visualization. So we target treatment to every individual, or we tailor treatment to every individual, and because we can see exactly where we're treating.
You can swap out 3 or 4 of the heads. As you go
in different
so
depths.
You can see exactly and treat at that right level.
So overall, a great foundation treatment for the right person, and there is a lot of good information out there that's freely available. We can certainly help our patients to find information if they're looking for it. But I think the best advice for anyone looking at a good foundation treatment is to go and seek advice from a clinician, usually a doctor, who knows what's out there, knows what all of the different treatment options are, and is going to be honest about whether or not they'll achieve good results.
So, Libby, you were in Bangkok
recently.
Yes, recently.
I was very lucky to be flown over to Bangkok, where I learned some advanced Ultherapy techniques, which was great. I've been in Sydney talking to other doctors about how we use Ultherapy or Ultherapy Prime in our clinic, and I've got a couple of other events coming up. I could talk about Ultherapy for hours.
We could, because we love it, and it is one of the most used devices in the clinic.
It's bread and butter.
It is. It's great. So
every face is different, and that's why personalised, evidence-based planning matters. If you have specific concerns or want tailored advice, consider booking with your local doctor-led clinic as a first step before considering any treatment.